Welcome to Rudraksh Wellness Talks. Today we have our guest Dr. Rebekah Subba, consultant pulmonologist. Keeping in mind the air pollution and respiratory infections existing in India, let's have a little bit discussion about it. How does poor air quality and pollution in India affect our lung function?
As a pulmonologist, I can tell you that air pollution is one of the biggest threats to lung health in India. When we breathe in polluted air, tiny particles, especially PM 2.5, these travel deep into our lungs and these can cause irritation and inflammation of the airways. People experience chest tightness, coughing, and burning sensation in throat. The long-term effect is even more serious as it can cause chronic bronchitis, COPD, and even lung cancer.
Which population is more prone to these ill effects of air pollution?
Children, elderly people, and asthma COPD patients are the ones who are most affected by air pollutants. That's why it's important to protect ourselves. We should use masks in highly polluted areas and we should avoid burning plastics and waste in our neighborhood, as this is also one of the major air pollutants. Clean air is not a luxury or a comfort, it is a basic requirement for healthy lungs.
So what are the signals that our body sends when our lungs are in trouble?
Here are the signals which we should not ignore. Firstly, cough that is persistent. If you've been having cough for more than 2 weeks, it means that your lungs are trying to tell you something. Secondly, if you are breathless doing simple activities like climbing a few flights of stairs or while walking a short distance, it means that your lungs are compromised. Thirdly, wheezing or noisy breathing. This indicates that your airways are narrowed or inflamed. Another symptom is frequent chest infections such as cough and cold, fever, chest congestion. This could indicate that your lungs are not functioning at their best. Chest tightness or heaviness is also misinterpreted as acidity or weakness, but it could actually be a breathing issue. And lastly, coughing up blood, even a small amount, should be treated by a doctor.
Why is it essential to consult a pulmonologist for breathing issues like asthma?
Expert advice by a specialist is always better than trying to manage asthma on your own, because wrong diagnosis, inaccurate medications, improper use of inhalers can actually worsen the condition. Under the guidance of a pulmonologist, asthma is fully manageable. People with asthma can lead healthy, comfortable and active lives.
So I see a lot of people using the same inhaler for all types of breathlessness. Is it correct?
It is important to understand that every breathing problem is not because of asthma. A lung specialist can help you identify whether the breathlessness is because of asthma or COPD, or whether it's because of fluid in the lungs, which is pleural effusion, or due to something else. Each of these conditions is different and needs different lines of management.
In a city like Siliguri where weather changes so fast, how can we identify that a lung infection has turned into pneumonia?
Because of the quickly changing weather, chest infections can sometimes turn into pneumonia. That is why we should be on the lookout for symptoms such as high-grade fever, persistent cough, sputum which is greenish or yellowish in color, and extreme tiredness. If you have any of these symptoms, you should visit a doctor and get an X-ray or CT scan done to confirm.
TB used to be a dreaded disease till the last few decades. Even after its advancement in the management, it is still common in India. What can we do to treat it effectively?
First and foremost, the stigma around TB must end. Fear and embarrassment is what often delays TB treatment. Delay in treatment will lead to complications of TB and it will allow the spread of TB to other people. We should remember that TB is a treatable illness and it can happen to anyone, even doctors and other professionals. So we should forget about log kya kahenge and prioritize our health first and seek expert help early. A pulmonologist is a TB specialist who is trained in treating all kinds of TB and not just the TB of lungs.
As TB is still so common in India, what are some symptoms we can look out for?
In lung TB, people usually have cough for more than 2 weeks, or there can be blood in sputum also. But TB can affect other parts of the body as well. This is called extrapulmonary TB, and in such cases, cough may be absent, but there will be other symptoms such as fever, night sweats, loss of appetite, loss of weight. Even one of these symptoms should prompt a visit to the pulmonologist for early diagnosis and treatment. Earlier the diagnosis, easier the treatment.
In case you're experiencing breathlessness, cough, fever, don't just second guess or self-medicate. Let your lung specialist give you the right diagnosis, right treatment at the right time. Thank you for your time and information. This is going to help our patients a lot. Stay tuned and we'll come up with more such episodes.